So good evening and welcome to tonight's logistics webinar. My name's Rachel Creek. I'm a former MSF field logistician and I'm currently working in the Sydney office with MSF Australia in the Human Resources Department. I began working with MSF in 2010 and I've completed 7 field placements with MSF as both logistics manager and logistics coordinator. I was fortunate to have the experiences of working in a number of different medical interventions in the field, including TB projects, HIV, malaria, nutrition, and maternal health interventions. I've worked in South America, in Asia, and in Africa during my 5 years in the field. Tonight I'm joined by 2 special guests who'll be sharing their experiences and perspectives on tonight's theme of logistics in the field with MSF. Sitting next to me is Jez Goldie. Jez is an all-round logistician who's completed 5 field placements with MSF, including South Sudan, Syria, DRC, Central African Republic and Liberia. He's worked as both a logistics manager and logistics team leader in the field and worked in both regular and emergency projects. And you've also worked in Ebola during the intervention, so welcome tonight, Jez.
Thank you, it's great to be here tonight.
Thanks. Next to Jez is Sue Bucknell. Sue is a supply logistician and she's just returned this week from her first mission in South Sudan. And Sue was working as Deputy Mission Supply Referent in Juba. So welcome back, Sue. Thanks for coming tonight.
It's good to be here.
So tonight's webinar will focus on the role of logistics and the logistician in the field in MSF all over the world. We've got approximately 30 minutes tonight, so if you haven't done so already, start posting your questions online. We'll try and get to as many as possible. We'll answer those that are most relevant to most people and then try and answer you back within the coming days if it's a more specific question. So Jez, let's start with you. You were initially recruited with MSF as an all-round or general logistician. Can you outline for us the skills that you brought with you to MSF from your professional background?
Sure. So my degree is in information technology and I worked for a short period of time in IT, and then I moved across into construction project management. I'm a client-side project manager for a small consulting firm in Australia. I started in MSF actually as a supply log, like Sue here, and then moved into more generalised log work. The work in IT, my background in IT applies somewhat. Obviously, we provide IT support and so on to the team, but also that kind of support role in general. However, the project management and construction side is probably one that I rely on more in the field. We do a lot of construction and maintenance, perhaps building or maintaining hospitals and structures, but also the majority of the tasks that we do have a project management element to them. Overall, our project is a project, but even the subcomponents represent projects in themselves that need to be run in that kind of structured manner as well, as best you can in that sort of fluctuating context.
Okay, so certainly those construction management and management skills helped you to apply and get recruited.
Yeah, definitely. I believe that was something that the team in recruitment here drew on as part of the selection for my engagement.
Okay, thanks, Jez. And Sue, where were you working before MSF? And when did you realise that your skill set might be useful for MSF in the field?
Before joining MSF, I was working for an engineering and construction company here in Sydney, UGL, as a logistics manager. So I worked on project logistics in large construction projects. But before that, I've had about 20 years experience in supply, working in manufacturing, maintenance industry, and then in the construction industry. First realised that some of those skills can assist MSF. A friend that I met on holiday who knew about MSF made me realise the amount of supply support required to run a hospital, getting the medical supplies. As Jez says, with all the construction, they need supplies for the construction. So there's a lot of supply support required.
Yeah, I think a supply in all projects is a really important element, and with that, transport is a big part of supply as well. Did you have that experience in the field?
Yeah, so transport was one of our responsibilities, getting the medical items and logistics items from Juba, where our main warehouse was based, to the projects in the north of the country. In South Sudan, there's certain challenges with that.
I remember my time there. It was definitely one of the bigger challenges in the wet season, especially.
Yeah, so your roads are only really accessible 6 months of the year. During the wet season, they're impassable. So for logistics supplies, where we tried to transport everything by road as the most efficient means, we would pre-position stocks before the wet season to cover the project for the 6 months. But for medical items, we can't do that, and also because of the sensitivity of the medical items, everything was transported by air. So we would manage the air transports with weekly flights using the MSF operated plane, and then air charters once a month for the bigger deliveries.
Okay. And did you have any experience managing planes or flights in your roles?
Yeah, certainly. I think Sue may have just glossed over the fact that arranging for a charter flight in South Sudan is not like it would be in Australia. You're not just calling up a company and saying, here, I just want to fly this there. We're talking about dirt airstrip out in remote areas. For example, in Central African Republic, I found myself responsible for maintaining the airstrip, which is clearly not something I'd done previously. That involves testing the material, the compacted dirt that we're using before each flight, coordinating as basically air traffic control with small flights coming in, and ensuring the safety of the airstrip, which can be anything from making sure that there are no goats wandering across that obviously cause an obstruction, to ensuring that there's actually safety in terms of the context around so that planes can land, and all the way through refuelling from drums of Jet A1 kerosene on the strip.
That's certainly interesting.
Absolutely.
Interesting times. So in MSF, non-medical roles, I'm not sure whether you're familiar or not, but non-medical roles make up about 50% of all international and national staff positions. So these supporting roles can range from management, administration, HR, finance, and also both general and technical logistics positions. Jez, can you maybe outline for us some of the main roles and responsibilities of logs in the field?
Sure. So as you're saying, if roughly 50% of the expats are non-medical, it's because the idea of a log is to ensure that the medical staff can focus on providing medical services to beneficiaries. And they need that support through having a structure in which to work, having reliable energy supply in places where typically we don't have town supply, clean drinking water for patients, providing drugs through a managed cold chain process to ensure that the drugs are still effective. Construction, maintenance, security, 16 trades, I believe.
Yeah.
It's definitely broad.
So cold chain is often a part of the logistics role. Did you have some experiences managing cold chain in the field?
Yeah, in fact, in all of the roles I've done, there's been an element of cold chain management because it is such a critical element throughout the process. Perhaps in Australia you can use refrigerated truck or refrigerated transport, but we're working, for example, in South Sudan, you would be working somewhere that's 43 degrees in a remote area with no energy. So we have systems in place. In my most recent project in Democratic Republic of Congo, the remote health centres we were supporting had been using kerosene fridges, which actually take a little flame running on kerosene to cool them. They're incredibly difficult to maintain the very strict temperature ranges, and you have to get fuel into very remote areas. So we went through a process of actually replacing those in a bit of a trial to put in solar fridges, which was a resounding success. We're really happy because it meant that in very remote areas they can guarantee the efficacy of critical vaccines in these locations.
Yeah, solar is something a bit up and coming in MSF projects.
Yeah, it
Seeing
is.
it more and more. I saw also in Chad.
Yeah, so we have to be relatively sure of the reliability of these things. It's not like you can just go and get a spare part, so it may not be the fastest change, but where we have them, we're starting to implement it, and it's something I'm seeing more over the years.
I'm just talking about 16 trades, so MSF does recruit many different logistics specialists, which we outline a bit in our 16 trades campaign. So we're looking for professionals with backgrounds in construction management, electricity, water and sanitation, and project management, just to name a few. So you as a supply specialist, what were your main roles and responsibilities in the field? And can you talk a little bit about the supply chain process in the field or your experience of it?
So as I mentioned before, we had our main warehouse in Juba for the projects we were supporting in the field. So there was an element of warehouse management. We had medical stocks there, so pharmacy management from the point of view of the stock management of the medicines. We were also responsible for procurement of the logistics items which we purchased locally in Juba. The medical items were all purchased from Europe, so we had a responsibility for the importation of the medical items. And then obviously, as we discussed before, the transport to the field, so getting those materials to the field.
And was the importation process, is that straightforward, or again, is that something quite different depending on the context?
It's not straightforward in the way that the Australian process would be straightforward. It is constantly changing. It's difficult to define exactly what you need to do, so it does take a lot of effort to understand what the process is this week, and next week it could change again.
So that adaptability is key.
Yeah,
Essential.
So you've both got transferable skills that you've managed to bring with you to MSF from your previous work. So what about some of the new tasks that you're expected to do in the field, or things that you've never done before? How do you tackle those as a logistician, and how do you prepare for those new tasks that you might be confronted with in the field? Yeah,
so certainly I don't imagine there are many people joining as logisticians who have all of those 16 trades that you've been talking about.
I know I didn't.
No, certainly, and it's unreasonable to expect people to have all of those. So I've been fortunate to undertake a few trainings with MSF. I did the logistics organisational training in Uganda. There was a 2-week intensive on-site training where we set up a mock cholera treatment centre that involved physically constructing the centre, setting up a water supply treatment centre process, bringing water out of a lake, deflocculating it, chlorinating it so that we would have drinking water for the centre, and through to radios, technology, project management, vehicle maintenance, generator maintenance and so on.
So really hands-on.
Absolutely. That's one of the things I think MSF does particularly well, is the trainings are incredibly hands-on and participative, so that you really gain the most and learn from the mistakes you make in that environment perhaps. But in addition to that, I've also attended the emergency response training, which was a training designed to upskill us a little in responding to complex emergencies. That's the whole reason MSF exists, is to respond to those complex emergencies. Most recently I've undertaken the field management training that was actually located here in Sydney, which was more of an HR and resource management side.
Okay. And so thanks for that, Jez. So there's obviously a lot of opportunity for travel international and locally. What about in the field for national staff? And did you find yourself involved in facilitating any training in the field as a log?
Yeah, certainly. We represent something along the lines of 10% of the staff working for MSF expats. Mm-hmm. So for every one of us, there are 9 national staff who we can upskill, but we can also learn a lot from. So there's a lot of informal training through working together, me learning about the local context, the way things are done, how things are done in this particular environment, and also bringing my experience and skills. So for example, my construction expertise, when I'm doing a project, I'll bring my staff along with me and try to share as much of that technical knowledge as I can through informal stuff. We also set up more formal trainings from time to time, especially in the medical side, but in logistics side, we also try, especially IT and so on, where people may not have been exposed so much, we try to do that, and across the board try to upskill national staff.
Thank you. So I mean, training is a great way to upskill, but it's not the only way for international and national staff to upskill. Jez, can you outline some of the other support services offered by MSF in the field to support you throughout mission?
Yeah, certainly. If, for example, you're in at the level of a logistics manager, you may have a logistics team leader working with you at field level, who will typically have more experience, who will be able to pass on some of that experience. And then in the capital, there will be a logistics coordinator who, again, may be either technical or management based, so they may be able to answer technical questions or at least guide you in the right direction. But then above them in the headquarters, they're a technical reference, so there will be perhaps a water and sanitation expert who really knows that very refined field, cold chain, biomed, construction and so on.
And sometimes they fly into the field to help with an assessment.
Absolutely. So from time to time you might have someone who will come just to do an assessment and provide a report. You may have someone who will spend a week, a month, 2 months implementing and helping you implement specific projects or fixing some particular area that required some assistance.
I know during my time spent as logistic coordinator, I had great help and support from the technical reference with these really challenging questions. So I know that the support was definitely there at all levels. So what about you in your experience? Did you find support in the references, tools and software that was available with MSF in the field?
Yeah, I think that's another thing where MSF is very strong. So when I had my initial briefing in Geneva, I was handed a USB key with the logistics referential on it. And that's also available over the internet if you're in a location where you can access internet.
It's like a library of
guidelines. So there's guidelines and procedures for pretty much anything you'd want to do. Everything that you think you need, somebody else has done it before. So there are good guidelines, procedures that you can refer to, and it will tell you how to set up whatever you need to set up.
If you're confronted with a cholera outbreak, for example, if you've never worked in cholera before,
it will detail how to set up a cholera treatment centre.
Yeah, that's a great example. There's actually a book specifically on how to set up a cholera treatment centre, because it's an organisation that's been around for some time. People have done this and we need to be able to respond quickly, so there are guidelines to help you tick off all the boxes and get it up and running as quickly as possible.
And they're very much developed over time and with experience. So they're developed based on the contexts in which MSF works. So they work for the context.
Very important element of it.
Yeah, it's really important. So I just wanted to ask you also in the field how you managed with the software, with supply, for example. What tools were in place to help you manage those supply processes?
Yeah, so the tools we had were fairly basic. MSF Swiss uses a system called Logistics 7, which is essentially an access database, and the reporting tools are pretty much built in Excel. But there's a reason for that, to keep them simple. The context that MSF is working in means that we can't have complex systems, we can't support them in most of the environments, and it's the most important thing is consistency for the national team, because as expats we'll come in, do a 6 or 9 month mission. So if we change all of the tools while we're there and then the next person does the same, there's no consistency for the national team. So although the tools are basic, they're functional, they do the job that needs to be done, and it enables that consistency, and it enables us to support them from the field.
And it also means that the next project that you turn up to, you know it's going to be
It's
the same tool.
You know how to take over.
Yeah.
And I guess it can be challenging with the internet, depending on the connection as well, managing different softwares and tools, and depending on what you need to access.
Certainly. It depends on the context, on the country, on the availability of internet in that country. If it's a new mission, if it's an emergency mission, it really can vary from absolutely nothing except for emergency satellite communication through to relatively sophisticated setups with VSATs in coordination, for example. And that is slowly changing in MSF actually, and finding a little bit more internet each year.
Yeah, I seem to find the same. It gets a little bit better every year. So for international staff going as an expat, you'll find supervision and management of national staff is always going to be a big part of your job description, even if you're a technical specialist, and so you're going as a technical log. Can you outline for us some of your supervision or management duties that you were required to do in your position?
Yeah, so my position was as a deputy supply, which meant I had a supply manager that I was reporting to, and they were generally responsible for the management of the staff. But South Sudan being South Sudan, during my mission there was a circumstance that meant the supply manager was out of the country for a couple of months, which then meant I took over the management role. So I had a team of 12 people in the supply in Juba, and we were also responsible for providing the support to the supply officers in the projects as well. In addition to that, you have the other management tasks of managing budgets, making sure that there's a good audit trail, so the procedures, especially in the procurement space, that we have to follow to make sure that we can account for all the money that's spent and where it's gone. So there is a lot of management around the processes as well.
So it's not just getting your hands dirty.
I think Sue makes a really important point there. While we need to have technical knowledge and background to be able to support the work, a lot of the time we will be in a management position. We will be, even as a log manager, the reason it's called a log manager is you are managing a team, and perhaps you won't for the whole time pick up a screwdriver or a tool. You will be managing staff, and you need to be comfortable with that, because it is everything from HR management, recruitment, managing budgets, preparing budgets, and there's a fair bit of paperwork and management in the background as well.
Yeah, definitely. Jazz, I just want to change subject now, but you've been working for MSF since 2012, and you seem to be managing the balance between life at home and life in the field quite well. How do you do it, and how do you manage that balance?
Yeah, it was a really tough question for me, I think, when I first started, because I had no idea where it would lead. I joined with the intention of going away for 6 months, took leave from my employer, and with the intention of coming back after 6 months and maybe going 6 months on, 6 months off. I came back 4 years later, having not followed that pattern at all. But I've been really fortunate since I have been back. I've managed to come back for 6 months last year. I then went again on another mission and came back and have been able to retake up that job once more with my employer here in Australia. He's been incredibly flexible with me, which means that I do have some sort of balance in there, and I do have the intention to go again in about another 6 months' time, about halfway through that break.
Fantastic. I will move to some questions in a moment. I just wanted to ask you, Sue, since you're fresh off the plane, what was the most challenging aspects of your mission in your time spent in Juba?
Yeah, I guess the context is what makes it challenging. When I started the mission, I was given the task of moving the medical stocks under the control of the supply team. It was previously managed by the medical team. So we had a plan. We were progressing along that plan quite well. And then in July, fighting broke out in Juba when we were halfway through the stock take as the handover point. And then once we had access to the warehouse again, we had 6 months of medical stock that we just received to be receipted into the warehouse. Because of the security situation in Juba, we needed to move 3 months worth of stock to the projects. At the same time, we were responding to the emergency in Juba itself, setting up mobile clinics. And then, because that wasn't enough, there was a cholera outbreak, and we then ran a vaccination campaign for cholera in Juba. And all of that was within sort of 3 or 4 weeks. So that was very challenging, but also very rewarding, because seeing how MSF was able to respond to those emergency situations and how the national staff responded so that we were able to achieve all of that in that time frame was very impressive.
Sounds like a challenging first mission.
Definitely.
Thank you. I might move now to a couple of questions that people have been sending in, so thank you. So Ali has written in, when do you intend to deploy logisticians, and what locations are the ones suffering from the greatest shortages at this point? So in terms of deploying logisticians, Jazz, Sue, we know there's a need, a constant
absolutely.
need.
So the system effectively is there is somebody in the field in a position, unless that project is going through some sort of change. When that person finishes their mission, somebody comes and replaces them with a handover period so they can learn what's required in that specific role, and that will continue to turn over. So there is always a project, a deployment finishing and another person coming in. So I guess the answer to that is constantly deploying logs. All projects need logs.
It's true. And in terms of the project locations, I mean, there's need across the world. Just to give you an idea of where we're sending Australian and New Zealand field workers currently, or where the greatest need, we're deploying Aussies and New Zealanders to South Sudan, to Yemen, Sierra Leone, Pakistan and Nigeria. They're some of the contexts we're sending a lot to currently, or that was, from 2015. But this changes depending on need and what's happening in the world and where emergencies are occurring. So we respond to that need and where we're needed most. So I might move to next question. So Martin's asking us, so logs are often in charge of security. What kind of support's offered to field logisticians in this regard? I might pass this question to you, Jez, as you've worked in a number of high security contexts.
Yeah, so I've worked in Syria and Central African Republic, which were probably the two contexts that were the most unstable at the time that I was there. I wouldn't say that logs are in charge of security on their own in any way. We have the project coordinator, who is the central point of contact for security in the field. We also have the head of mission and the project coordination team, in the capital. Security management is an everyday, constant process where we obtain through our networks information that we use to assess our own security. And we, as a log, we are always supported in that through our project coordinator and through the capital team, because it is a shared responsibility to ensure the safety as best as we can for the teams in the field.
Thank you. I might move to our next question, Alicia. Alicia asks, what would you recommend as a course of action for someone interested in getting into this kind of work? Or is there a particular field of study recommended? Alicia, I think there's no particular field of study recommended, but it depends on your work background. In any logistics profile, you'd need to have that 2 years professional experience in one of the logistic areas that we are focusing on. So be that construction, electricity, water and sanitation, in project management, supply, etc. So if once you feel like you've built up that few years of professional experience in one of those areas, mechanics as well, biotech, so any of those areas, then that would be the good starting step for an application as a logistician with MSF. So we might have come to the end of time. It went quick.
Yes,
I'd like to firstly thank the viewers who've been posting their questions tonight. And also very much a big thank you to our special guests for joining me and joining in the conversation about logistics in the field with MSF. So thanks, Jez and Sue.
Thanks, Rachel, for the opportunity.
Thank you. Field logistics in MSF is an extremely challenging but rewarding job. So I think we've heard many examples tonight of how it can be both challenging and rewarding. But I do urge you, if this webinar has resonated with you tonight, to go to our website and have a look through everything, especially the non-medical part, and go to the Join Our Team section to lodge an application when you feel that the time is right. So thanks all again for watching, and I wish you a good evening.
Thank you.
All right, thanks.